If you think somebody's overdosing, first thing you want to do is look for signs and symptoms. Are they not breathing? Are their lips and fingernails turning blue? Are they snoring or gurgling or making choking noises? Things that sound like breathing but aren't actually breathing. They're limp, they're throwing up. These are all signs that someone's overdosing. If you think somebody's overdosing, first thing you want to do is double check. So you're going to take your knuckles and rub them along their sternum. And this is you're trying to cause pain. Because if someone's not overdosing, they're gonna react to that. They're gonna push your hand away, they're gonna say, stop it. And if they're not responding to that, that's when you know that you need to act. So you're gonna call 911. You wanna get emergency services on the way to take over if something goes wrong. So it's possible the person isn't overdosing off of opiates, so you want them on the way. Or that they have some other health effect that's going on. Mm-hmm. So you're going to call 911. If you have someone else, they can call 911. You can administer services. So first thing you're going to do is you want to give them rescue breaths. So brain damage happens in 3 to 5 minutes. So we want to try and get oxygen to their brain. So you're going to tilt their head up and pinch their nose, and then you want to give them 5 breaths over 30 seconds. So give them a breath, you take a breath. Give them a breath, you take a breath. You want to see their chest rise and not their stomach. Mm-hmm. So if their stomach is rising, you either need to tilt their head up more or remember to plug their nose. Sometimes just giving people those first few breaths can revive them. If so, you want to stay with them, keep them talking. If someone's talking, someone's breathing. So make sure they don't fall out again. If that doesn't work, then you want to give them the Naloxone. So we're going to give everyone one of these kits. In your kit, you're going to have 2 doses of Naloxone, 2 muscling syringes, a face mask so you don't have to put your mouth to their mouth, alcohol swabs, and directions in case you forget what you're doing. So what you want to do is you want to pull out 1 of your doses of Naloxone and 1 of your muscling syringes. And as you can see, we use water for demonstration, but this is about how much 1 dose is. So you want to pull that entire dose into your muscling syringe. So that ends up being 1 cc in a 3 cc syringe. And then you want to inject it into the muscle. So upper arm, thigh, upper butt. You're going to put it in at a 90-degree angle, push the entire plunger in. Once you do that, you're going to go back to breathing for the person. So if you're not giving Naloxone, you're breathing for the person. And you want to breathe for them for about 3 minutes. What I usually say is when you start to get tired, it's probably been about 3 minutes. And then if they haven't woken up, you're going to give them that second dose of Naloxone. So the same process, new muscling syringe, second dose of Naloxone, pull up the entire dose, inject it into a muscle.
Gotcha.
When the person does wake up, they're going to be in withdrawal and they're going to be confused. So you want to let them know what happened. Hey, you were overdosing, I gave you Naloxone. You're going to feel better in about 30 to 45 minutes. And you don't want to let them use immediately. And you don't want to let them use for a couple of reasons. One, once the Naloxone wears off, a person can fall back into overdosing. So it's another reason to have 911 on the way, have EMS services. If they do fall back, you want someone there to take over. The other reason is because it's blocking those receptors, they're not going to feel it. And so it's going to be, a waste of the drugs that we worked hard to get. If you do have to leave the person for any reason, you want to leave them in this recovering position. So on their side, top knee out, arm under their head. That way if they do throw up, they're not going to choke on it, they're not going to asphyxiate. Do your best to store it at room temperature. So don't put it in the fridge, don't put it in your car. If you can keep it on your person, if you're homeless, or in your backpack. And store it in a place where everyone knows where it is. So a medicine cabinet, if you can, maybe with your injection supplies, and let everybody know where your kit is.